Greetings, fellow North Carolinians. Thank you all for joining us this afternoon. My name is Quinn West Godwin. I am the Acting Engagement Director for the 75th Governor of North Carolina, Governor Roy Cooper. Governor Cooper, along with Cabinet Secretaries, agency staff, and thousands of state employees, have been working nonstop to fight this pandemic and help the people of North Carolina get through this tumultuous time. Our purpose in these engagement sessions is to have multidimensional information sharing, to make sure we are available, transparent, equitable, and connecting with all North Carolina communities during this crisis. Before we get started here today, I would like to take some time to recognize the solemn date. And Governor Cooper yesterday ordered all United States and North Carolina flags at state facilities to be lowered to half-staff from sunrise to sunset today, September 11th, in tribute to Patriot Day, also known as the National Day of Remembrance and Service. This day honors the victims of the 9/11 tragedy, their families, and the heroic sacrifices of the first responders. Governor Cooper released a statement today accordingly, and it reads as follows. Today, nearly 2 decades after September 11th, 2001, we mourn those who died and remain grateful to those who rushed in to help. In Washington, New York, Pennsylvania, and here at home, bravery and strength prevailed, and lessons of service and sacrifice remain as strong today as they were in 2001. Please join us as we remember the thousands of innocent lives lost during one of the most deadly attacks on U.S. soil. Last week, Governor Cooper announced that after a summer of hard work to slow the spread of COVID-19, North Carolina would take a modest step forward and move into phase 2.5, starting last Friday, September the 4th at 5 p.m. Mask mandates and other prevention methods still remain in effect and are even more important to contain this virus. Today's program will focus on these updates and more. And just like our previous sessions, we encourage you to engage with us via the YouTube stream chat or the WebEx stream where you can send questions in real time. During our program today, we will hear from Mr. Benjamin Money, Deputy Secretary for Health Services at the North Carolina Department of Health and Human Services, Ms. Caroline Farmer, Director of the Office on Volunteerism and Community Service, Mr. Jeremy Collins, former Director of OPE and now Director of Innovative Connectivity with Governor Cooper's Hometown Strong initiative, and lastly, Ms. OKIRAH Harris, my colleague in the Office of Public Engagement, will address added concerns sent today and close our session. Again, thank you all for joining us. This afternoon, I now invite Deputy Secretary Mr. Benjamin Money to the stage. Thank you.
Thank you, Quinn. Good morning, fellow North Carolinians. As Quinn mentioned, last Friday, Governor Cooper moved our state to Safer at Home, phase 2.5. Our state's dimmer switch approach to easing some restrictions is based on science and key metrics. And what we've seen in North Carolina is some stability in our key metrics. But we need to be moving downward in our cases and upward in terms of our testing. So let me give you just a brief update as to where we are right now. As of today, there have been 182,286 laboratory-confirmed cases of COVID-19, with 1,532 new cases reported today. And unfortunately, there have been 3,023 total deaths. In terms of testing, there have been conducted in North Carolina 2,558,654 tests, which means that we're averaging about 28,000 tests per day right now. But our goal is to be at 40,000 tests per day. So still some work to do. Also, in terms of our positivity rate, we're roughly around 6.2% positive. And again, our goal is to get below 5%. Yesterday, there were 121 people that were admitted to the hospital with COVID-19, and currently there are 938 individuals in the hospital, with COVID-19 and 292 of those in the emergency care unit. Right now, we don't have any hospital bed or ventilator capacity issues, but again, this is something that can change quickly, and we want to be very mindful of that. What we are seeing, though, is an increase in cases in the 18 to 24-year-olds. We start to see some leveling off. Again, this is a result of outbreaks on college campuses resulting from students returning back to college. But what we're going to see 14 days out from Labor Day will really be the true test. Did North Carolina heed the guidance to follow the 3 W's? Remember, our 3 W's are wearing a face covering, waiting 6 feet apart, and washing our hands. So as we take modest steps forward, it's important to remember that our forward progress doesn't mean letting up on slowing the spread of the virus. What it means is that our progress is fragile, and it's not where we want it to be. There are some parts of our state that have plateaued at stubbornly high rates of viral spread. The lessons that we've learned from other states continue to indicate that we need to ramp up our prevention and our testing before further reopening. We need to maintain our focus on the 3 W's, especially as we head into flu season. It's important that everyone who can get a flu shot does so. We want to preserve our COVID testing and our hospital capacity. Remember, the seasonal flu can be life-threatening. And North Carolina, as much of the country, has seen a rapid increase in some of our cases of the 18 to 24-year-olds. As I mentioned, we're doing a lot working with our college campuses to assure that they are adhering to prevention guidance. We're also working with other institutions of higher learning, as well as our K through 12 schools and campuses, to make sure that we are supporting their efforts at the local level. And we continue to keep an eye on increasing cases, particularly as students from universities are being sent home. Also, it's important to recognize that what phase 2.5 means for North Carolina. It means that the mass gathering limits will increase from 25 people to 50 people outdoors from the current 10 indoors and 25 outdoors, that playgrounds will reopen, that museums and aquariums can open at 50% capacity, that gyms and indoor exercise facilities such as yoga studios, martial arts, rock climbing, as well as skating rinks, bowling alleys, indoor basketball, volleyball, etc., may open at 30% capacity. But bars, nightclubs, movie theaters, indoor entertainment facilities, amusement parks, dance halls will remain closed. And also, large venues still remain subject to the mass gathering limits. One of the things that we've also done in our efforts at mitigating the spread of COVID-19 is institute a new statewide public education campaign. It's called Whatever Your Reason, Get Behind the Mask. We've done it in English and in Spanish, and it's really designed to encourage every North Carolinian to wear a mask in our collective fight against COVID-19. This is a distinctly North Carolina campaign which features real North Carolinians in places and focuses on the personal reasons that we in North Carolina have for choosing every day to do our part in curbing the spread of COVID-19. One of the things we also recognize is that as people come in contact with individuals that have COVID-19, if they're suspected prior to being tested, they're being asked to quarantine. If they are tested positive, they're being asked to isolate. And we know that this puts a burden on individuals as well as families. And so one of the things that we've done at DHHS is created a quarantine and isolation supports program. And we recently awarded 4 contracts to regional organizations to administer this support services. Right now, we're focusing on 20 targeted counties where there's high need. And we're asking that individuals that are asked to isolate and quarantine reach out for assistance. The case investigators and contact tracers will have this information. And one of the things that this program will offer is assistance such as food, COVID relief payments, as well as access to medical care. So anyone who's tested positive is going to be asked to isolate or quarantine, is going to be asked to isolate for 14 days. If they've, again, been suspected of being exposed to COVID, they're going to be asked to quarantine. And so we want to make sure that people have their basic needs met. And this program is really designed to do that. And it's going to run through the end of 2020. One of the things that is really important to recognize is that these services are going to be directed and provided through community health workers. These are individuals in the community, trusted sources, folks that have been trained to provide these resources. They're going to coordinate the services that will include such things as nutrition assistance, a one-time COVID relief payment to assist individuals and their family in meeting basic needs, as well as safe transportation to essential locations such as non-congregate sheltering and medical visits. We're going to be utilizing telehealth for access to primary medical care, offering medication delivery, as well as some over-the-counter supplies such as face coverings, hand sanitizers, thermometers, and other cleaning supplies. So look for that program and more information publicly available. The other thing that we are involved in is an effort to allow people to be notified if they've been exposed. And there's a phone-based application that's called Slow COVID NC that's currently in beta testing, but we'll be distributing it broadly. This app for your phone will help North Carolinians slow the spread of the virus by alerting them when they may have been exposed to someone who was tested positive. Right now, our beta testing is occurring with university students, and we're going to be rolling it out to campuses very soon. This program, as I mentioned, is phone-based, so it leverages Google and Apple exposure notification systems, which, if you've updated your phone, the hook is already on there. The app you have to download it, but the app is completely anonymous. It does not collect or store or share personal information or location data. This Slow COVID NC program is voluntary. It's voluntary to download, to use, and it's designed to support our state's contact tracing efforts. The app, once we finish beta testing, is going to be available free of charge, and it'll be available for download through the Apple Store or Google Play Store. The other thing that you'll notice if you've gone to our website recently, www.ncdhhs.gov, is we've added additional data to our data dashboard, including the average turnaround time for COVID testing and linking to our COVID testing page so you can find a testing site and you can also check your symptoms. Those resources are still available. We also continue to update our guidance. Additional guidances is available for college and universities, and we're increasing our testing capacity for counties through some new initiatives and new testing vendors that we have available. And we're working on additional toolkits for communities, community groups, to partner with our testing vendors on setting up testing events. So recognize the fact that there's a lot of work underway to mitigate the spread of COVID-19. But all of us can do our parts. We can do our parts primarily by recognizing that phase 2.5 is safer at home, that by wearing a face covering, by waiting 6 feet apart, and by washing our hands, that we can help to curb the spread of COVID-19 within our state. We can curb the spread, we can move ourselves to a greater phase of reopening, and we can get ourselves back to normal by following these very simple guidelines that I've mentioned before. I want to just thank you all for your continued engagement in this effort, your participation in these web-based forums, as well as really following the guidance that we've provided. So if you work in a high-risk occupation, if you believe that you've been exposed to someone with COVID-19, want to make sure that you get tested, want to make sure that you have the resources that you need to isolate and quarantine appropriately, and we want to make sure that you stay safe and healthy. Thank you so much again for your continued participation and cooperation, and at this time, I'll call up Carolyn to give us an update on some volunteer opportunities. Carolyn?
Good morning. My name is Caroline Farmer. I'm with the Commission on Volunteerism and Community Service within the Governor's Office. It's been a month since we talked. I really appreciate you being here again. So the Commission on Volunteerism, as you've heard me say before, we specialize in volunteers and donations during a disaster. Now, a disaster can be a hurricane like we had last month. It can be COVID-19. So all this time we've been working to try to make sure we're meeting the needs of the state, and you are a big part of that. Now, last month we had the first hurricane of 2020 hit North Carolina. We had to activate the North Carolina Disaster Fund. You will find that on the governor's page, on most of the state agency pages. We are trying to encourage people to help. Now, what is that fund for? It's to help organizations that are going to rebuild the 24 houses that were completely demolished and flattened in Bertie County. Those people lost their homes, they lost their furniture, their cherished photos, their clothes. They're having to find housing and meet basic needs right now. It's a month later. It will be years later before those houses are rebuilt and finalized. So what does this mean for you? It means that ongoing support for hurricanes is going to be necessary. If we get hit by another hurricane, we will need help with shelters. I want to encourage those of you paying attention right now to either email us at volunteernc@nc.org or go to our website, volunteernc.org. And there's an opportunity to hear about what the volunteer opportunities are. We can send that information to you so you could sign up and get information about what it's like to be a shelter volunteer. So please go ahead and consider signing up so you can hear more information about helping us if another hurricane hits North Carolina. So in the meantime, we have COVID-19, feeding. All these needs are still raging. Mental health is suffering. And places like the food bank, they're needing cloth masks. They need volunteers. So that is an ongoing need that we want to start scheduling, not just one-time visit, but once-a-month visits, so that they can count on you and your support as a volunteer to go and make sure that the food leads the food banks and goes to the smaller pantries in the smaller communities in eastern North Carolina where jobs have been lost, where people are in dire need of food. Another thing that we're seeing is schools, the feeding. Some of the students cannot make it to the locations where the feeding is being offered. Look into what's happening in your districts and see if there's a way that you can assist those schools in delivering food to the students in need. It's usually a week's worth of supplies or twice a week. So consider helping out some of those students that this is their only meal of the week. Now, it's phase 2.5. Now, what does this mean for us? It means that more volunteers can be engaged. It means when you're at the food bank, you're not limited to 10 at a time, it's 25. Now, you still need to be wearing masks, you still need to be wearing socially distanced, you washing your hands and so forth, but you can volunteer. The need is great. And with that extension, we are allowed to have more people helping out. So I would encourage you to look at the opportunities available on our website. We have the food banks and food pantries listed, the links to all of them, so you can find out if there's one in your area that you can start helping. And I'll be honest, this is 6 months later, phase 2.5 now. I did not know back in March when this started that we would still be talking and communicating. I did not know that the needs would still be so great. I know for me, I'm just grateful that you are joining us, that you're wearing your masks, that you're taking it seriously, and that you're helping people. Now, next, schools have started. And there's going to be a push coming up soon for education volunteers. There is a need to tutor. There is a need to mentor. Some of these kids are not seeing another adult, and so you can do this virtually. If you have an interest in being involved in education remotely, would you please go to our website, volunteer to hear about the opportunities. You can sign up and you'll get an email whenever, usually it's about once a week, about the volunteer opportunities, and that will be coming shortly. So on behalf of the governor, stay tuned, keep on volunteering, and thank you for all that you do for this state.
Good morning. Thank you to Director Godwin and OPE for having me this morning. I'm very thankful for Deputy Secretary Money and Director Caroline Farmer for their presentation this morning. I'm excited to be here to talk with you about our new initiative to bring quality, affordable, accessible, high-speed internet to every North Carolina home over the next couple of years. As Quinn mentioned earlier, my name is Jeremy Collins, and I now have the pleasure of serving Governor Cooper as the Director of Innovative Connectivity. You may have seen over the past 4 or 5 months the governor's initiative around NC Student Connect, and that program has culminated with an announcement earlier this week to allocate $40 million to bringing over 100,000 hotspots to students and families that are previously unable to connect to high-speed internet in furtherance of virtual or distance or remote learning. $30 million in assets towards hotspots, $8 million towards turning public sites into Wi-Fi spaces, and $2 million towards literacy and training the teachers and the persons who will have to help folks to be able to access that service. But we know that the hotspots and the devices are a Band-Aid. They're a stopgap. We have a real issue in North Carolina where 259,000 homes in North Carolina are not connected to high-speed internet. Over 190,000 students are not connected to high-speed broadband internet. This is an equity issue because where in rural spaces there may not be any connectivity, there's also an urban divide in high-speed and broadband connectivity because the service in those spaces is much too expensive. This morning, I'm excited to talk with you about how we are beginning a new initiative that we're branding NC at High Speed to bring together all necessary stakeholders, ISPs, solutions providers, state government entities, the military community, our education community, our public health community, all towards the goal of bringing affordable, accessible, and quality high-speed internet to every home in North Carolina. You'll hear more about this, but what I want you to know is a couple of things. First, if you are a school leader or a community leader, and your community does not have high-speed connectivity, or you know that your school has a number of students, I'm thinking about my home community of Martin County, where some 40% of the population is not connected via broadband or high-speed internet. We want to hear about that. We want to be able to get you the resource that you need so that the students can get the education they need. To put this into context, today, if a student can't meet the minimum requirements for connectivity, and that's 25 megs download and just 3 megs upload. If a student can't meet that connectivity, they are essentially barred from the classroom. And what that means is they have to rely upon secondary materials, printouts, going to get things, and they're not able to participate in the learning experience in a way that we all know is beneficial. So if you are in one of those situations and you need we need to get connectivity to you, send us an email. You can email me directly, jeremy.collins@nc.gov, and we'd be happy to get you the information that you need or get you connected with either our Hometown Strong office or our North Carolina Business Committee for Education. The two folks that lead up those offices, Mary Penny Kelly and Caroline Sullivan, are doing an amazing job at managing this effort of NC Student Connect in consultation with Jeff Coltrane and the governor's education advisor. And so if you are both either a community member or a school leader and your community needs additional connectivity resources, we want to know that. Secondly, if you are a community partner and you see the greater good in helping to get broadband or high-speed internet across the state, you are a stakeholder. We need you. This is not just an AT&T, a Google, a Verizon, a Spectrum problem. This is an all-hands-on-deck issue. It's a fairness issue. It's an access issue. And so we need to bring all of our resources to bear. The business community, the hospitality community. This is not just an issue where we can allow residential folks to duke it out with the service providers. This is a time for us to come together and recognize that no access to broadband is no access to economic development, no access to sustainable 21st century enjoyment of life. The governor's mission statement remains building a North Carolina where people are healthier, better educated, where they have more money in their pockets, and they're free to live a more purposeful and abundant life. If you are a North Carolinian living without access to high-speed internet, those chances are as well significantly hamstrung for you. And so I'm excited about this initiative. I'm excited about doing this work. I'm excited about the partnerships and the coalition that we're building to do this. Our NC Student Connect effort is still moving strong. If you are a community that's disconnected, we want to help you as best we can. And if you are interested in joining our movement around building a strong, quality, accessible, and affordable high-speed internet, we want to hear from you. Please feel free, again, to shoot me an email, jeremy.collins@nc.gov. Thank you to OPE, Director Godwin, and thank you to all the folks that are putting out this great information that we all need to keep our communities safe and well. Thank you.
Good morning, everyone. My name is OKIRAH Harris. I serve as the Assistant to the Director of Public Engagement at the Office of the 75th Governor of North Carolina, Governor Roy Cooper. Thank you to our speakers for being here today, and thank you all for joining our session. As we have entered eased restrictions in Phase 2.5 under Executive Order 163, which went into effect September 4th at 5 p.m., a few things have changed. As Mr. Money said previously, under this order, mass gathering limits have been increased to 25 people indoors and 50 people outdoors. Social distancing and face covering requirements remain in effect. Playgrounds will be allowed to open. Museums and aquariums can open at 50% capacity. Fitness facilities can open at 30% capacity. And all employers in North Carolina are strongly encouraged to provide face coverings for their employees. We want to make sure you have up-to-date information and resources that are available. Before we wrap up our session, I want to address some frequently asked questions. There have been questions regarding fitness facilities reopening. And under this order, the fitness facility guests are required to still wear face coverings, but excludes when you are strenuously working out. Strenuous exercise can include running and jogging, but ultimately vary from person to person. Each individual must assess whether they are performing an exercise that allows them to wear a mask. Entertainment facilities, including movie theaters, bars, nightclubs, amusement parks, and others, will remain closed. For more guidance, we encourage you to visit the North Carolina Health and Human Service COVID website at covid19.ncdhhs.gov/guidance. Again, we thank you all for joining us today. Please stay safe, wear a mask, wash your hands, social distance, and have a good one.